Health Day 2022. Really happy One Health Day, right? So on our Ohio side, it's gloomy, very cloudy day, but it's going to be a wonderful day for sure. Good afternoon, good evening, our global audience as well. I just want to say a few words before we kick it off to the wonderful distinguished panelists. As you all know, the world is at a very important inflection point. One Health is being recognized more and more by the key leaders worldwide in the aftermath. We hope to think in the aftermath of COVID-19, even though we're still progressing on mitigating COVID-19, but for sure, the intersection, but interconnectedness of the world and the interface of human health, animal health, plant health, and the environment is more and more recognized by the world leaders. That's really great, great to appreciate, and we have a lot more opportunities, a challenge of opportunities to tackle as One Health practitioners globally for all of you in the room as well as virtually. Just to say a few things about Global One Health Initiative. When we set out building Global One Health Initiative in around 2012, very few people around the world or institutes understood what One Health stands for and the significance of it. There was lots of confusion, but for sure, nothing really teaches us better than reality. So when the reality kicks in with the pandemic, the world really woke up and understanding the role it plays, really bridging the gap between, the silos, across disciplines, across department, administrative barriers, and really addressing more and more complex issues, be it an epidemic or a pandemic or climate change, air pollution, and so many other related issues really necessitate integrated approaches. I think we're recognizing that, and today I'm sure our panelists who are highly accomplished scientists, members of our Global One Health network are here. So I really look forward to see the discussion, to hear the discussion, but definitely I welcome you all. So thank you so much for joining us this morning. I also would like to thank all of you in the room and virtually to really express my gratitude to the wonderful work many people are doing within our network, as well as beyond in the One Health field in general. But, our Global One Health network, be it in Ethiopia, Brazil, Mexico, Southeast Asia, and of course in Ohio and US are really doing great work, making a difference. We're doing the best we can, but really my special thanks goes to our own Global One Health Initiative team, both in Columbus and globally. The networks of people like Professor Rafael, who joined us from Curitiba, Paraná today, and many others who are not in the room, but also really making a difference globally. And we have a large staff members, Go High family members in Ethiopia, the Global One Health affiliated entity, Ohio State's units. Greatly appreciate people really doing work on the ground, are making us all proud. We started out with 2 people when the moderator, Professor Nicole Kraft, and I were on the ground 2017 when we opened that office. She reminded me there were 2 employees at the time. Right now, we are passing 560 strong, wonderful, multidisciplinary team members making a difference in Ethiopia. And thank you all, and thank you for your leadership. So yeah, just to, as Ohio State Buckeyes, we are all delighted to also welcome the different guests and different projects we do. Recently, to mention a few things Go High did within the last 1 year, a year and a half since COVID, we were able to establish 5 molecular diagnostic laboratories in Ethiopia. The country had 1, so increased it by 400%. That means a lot. It's prompted by COVID-19. It's a silver lining of COVID-19, but making a big impact. We're able to rehabilitate 9 hospital-based laboratory systems as part of public health emergency management, and key leaders, including Dr. Bisesi, Dr. Wang, Amy Mihalakas, and Laura Binkley. Many of you are in the room, and also many of you in Ethiopia. I'm sure you are in this virtual, in this panel. That is after a conflict because of some civil war conflict happened in Ethiopia, but that's public health emergency management, which broadly as a global one is an important issue. But also I'd like to congratulate Ethiopian fellows, partners, compatriots there for the peaceful resolution that was settled yesterday. So that's a big news and great news for the nation. And we look forward to expanding our Go High work. We have the resources, the momentum to expand to the conflict region in the near future as peace resumes. So thank you so much. So thank you, all of you, but special thanks to Dr. Amanda Berian, our Director of Outreach and Engagement, as well as Dr. Laura Binkley, who are spearheading this event. We greatly appreciate that. And special thanks also to our moderator, Professor Nicole Kraft. So I will introduce her and then leave the floor to Professor Nicole Kraft. Professor Kraft is Associate Professor of Communication, focusing on journalism and medical ethics. She is the Director of Ohio State's Sports and Society Initiatives, taught health communication as part of One Health Summer Institute with us. We did many things, in fact, really building journalism capacity at the University of Gondar, training capacity building at our annual Global One Health Summer Institute, further also strengthening electronic capacity building, including I was her student in been flipping my molecular epidemiology class from into a virtual version, right? So I think that's the first day we met way before. She is the author of really one of the famous books she wrote, Always Get the Name of the Dog, a guide to media interviewing. Nicole was honored in 2022 with Ohio State's Alumni Award for Distinguished Teaching and the Journalism Educators of America's Lindsay S. Pontney Teacher Inspiration Award. She was inducted in 2015 as an Apple Distinguished Educator. Apple took her away from us. I have some grudge on Apple, but I'm very happy for her, Apple Distinguished Educator. And most recently in 2022, inducted into the Academy of Teaching. So congratulations, dear friend, Nicole, and welcome and thank you. Thank you all our distinguished panelists. So God bless you. God bless this event. Thank you.
Thank you so much, Wanda-san. It is an absolute honor to be here with you. I never imagined I sat next to Wanda-san at a lunch because it was literally the only seat open. And he said, would you like to go to Ethiopia? And I'm like, yes, I would. And here we are many years later. I am extremely privileged to be the moderator of this panel and to introduce you to our illustrious panel. I'm going to start on my far right with Dr. Donald Amathuna, who's an associate professor at the Ohio State University College of Nursing and associate director for research of Ohio State's Center for Bioethics. His research addresses ethics during disasters and humanitarian crises, as particular research and One Health ethics. He's the principal investigator for a recently funded U.S. National Institutes of Health project and I'm sorry, this microphone is like resonating in my ear. And he is also implementing a Master's of Science in One Health and Emergency Research Ethics program, a joint initiative with the University of Nairobi in Kenya and the Kenya Medical Research Institute. During the peak of the COVID-19 pandemic, he conducted research into moral distress and moral injury in nurses. No shortage of that, I'm guessing. On the ethics of how evidence informs policy and practice during pandemics, and on ethical and regulatory issues with One Health research. Dr. Amathuna is also a member of the Scarce Resource Allocation Committee at the Ohio State University Wexner Medical Center and the Research Ethics Review Committee of the World Health Organization. He's contributed to ethics initiatives with World Health Organization, UNICEF, and other international organizations. He's also authored numerous peer-reviewed articles and co-edited several books. Welcome, Dr. Amathuna. We're thrilled to have you. Next On our line here is Dr. Sharon Santoso Clark, internal medicine pediatrics physician in the Division of Hospital Medicine at Ohio State Wexner Medical Center and the section of hospital pediatrics at Nationwide Children's Hospital, where she serves as the section chief of adult hospital medicine and the director of patient experience for the Division of Hospital Medicine. She's also an associate medical director for university hospitals with a focus in patient experience. She's a clinical assistant professor at Ohio State's College of Medicine, and she specializes in the care of hospitalized children and adults while also being actively involved in resident and medical student education. She has a special interest in global health, working in Indonesia and serving as founding leader of Ohio State Wexner Medical Center's Global Health Interest Group and director of the Global Health Scholars Program for residents. She is also working with Ohio State's Global One Health Initiative, planning the internal medicine series for the annual Global One Health Summer Institute, building capacity among health professionals in Eastern Africa and beyond. My favorite thing that she does, though, is with her golden retriever, Ashby. She volunteers as the core handler with Dog Team with Buckeye Paws, a certified therapy dog program with the mission of supporting the mental and emotional health of faculty, staff, and students here at Ohio State. Next, who I've had great pleasure of traveling with, is Dr. Michael Bisesi. He is presently the Vice Dean of Academic Affairs and Academic Administration and Professor and Chief Environmental Health Sciences in the College of Public Health here at Ohio State. He also serves as a strategic administrative advisor and co-founder of the OSU Global One Health Initiative and serves in an advisory leadership capacity for the Infectious Disease Institute, Global Water Institute, and Sustainability Institute. Dr. Bisesi is an environmental and occupational health scientist with comprehensive education, training, global experience, licensure, and certification associated with recognition, evaluation, and control of human exposure to chemical, microbial, and physical agents in air, water, soil, and food matrices, applied environmental toxicology and microbiology, and hazardous material emergency incident recognition and response. He has served on other committees and councils in the state. I don't know how you have time to do anything else, Mike, at the national and state levels, including presently serving as an environmental exposure science expert and Governor DeWine appointee to the Ohio's Radiation Advisory Council. He's also authored and co-authored several best-selling books in environmental and occupational health sciences. Welcome, Mike. And next in our distinguished panels, Dr. Rafael Vieira, currently an associate professor of epidemiology of vector-borne diseases, zoonoses, and One Health in the Department of Veterinary Medicine at the Federal University of Paraná, Brazil. He completed his doctorate of veterinary medicine at the Federal Rural University of Pernambuco and his veterinary residency in laboratory diagnostics at Sao Paulo State University. He's also completed his master's at the Federal University of Paraná and his PhD at Londrina State University in Brazil. Dr. Vieira is the principal investigator of several research training capacity building projects and is actively engaged in research and teaching focused on ticks, tick-borne diseases, and One Health. Over the past 11 years, his research has focused on zoonotic diseases with an emphasis on the epidemiology of vector-borne and transboundary infectious diseases. One Health molecular detection and characterization of novel bacteria, including homotropic mycoplasma, and I can't pronounce this. I went through pronunciations of names, but not all of these things. Anaplasma, do you want to help me? Anaplasma? Okay, we'll go with that. Species and evaluation and validation of diagnostic tests for zoonotic infectious diseases. His research portfolio includes more than 100 peer-reviewed publications on the Medine and Scopus databases. His professional goal is to apply his background to approach global health issues at the human-animal environmental interface from a One Health perspective, with a special focus on vector-borne and zoonotic diseases. Welcome. And last but never least, Dr. Rebecca Garibed is a professor in the Department of Veterinary Preventive Medicine in the College of Veterinary Medicine and a courtesy faculty in the Division of Epidemiology in the College of Public Health here at Ohio State. She directs the Disease Ecology and Computer Modeling Laboratory and is head of the Global Engagement Program at the College of Veterinary Medicine. Dr. Garibed received her veterinary medical degree at University of Pennsylvania before pursuing both a master's degree and PhD in epidemiology at the University of California, Davis. She was briefly an associate veterinarian at a small animal practice and has conducted infectious disease research in animal populations in Central Africa since 2010. She currently teaches courses in epidemiology and population medicine to our veterinary students. Welcome. Can we have a round of applause for this incredible group? Well, I don't feel at all equipped to be on this panel as someone who focuses on journalism, and obviously my pronunciations could use some help. But I have been privileged to work in this One Health experience, and the experiences that I've shared with Wandison and other members of the One Health initiative were life-altering in truth. And so I'm hoping that you can share with us, and maybe you could start, and we'll go down the line, with your journey into One Health. How did you become involved? Why did you become involved? And kind of what is the significance to your life and your career? Thanks. That's not pressure. I'm gonna put you on. I'm going to go off.
There we go. All right. Okay, so I guess thinking about how I got into One Health, I went to veterinary school. I became a veterinarian, and I feel like it's always been sort of an integral part of veterinary medicine. I started kind of focusing on livestock and population health, and it is very clear when you're studying the medicine in that context that everything from how the plants are grown that those animals eat and what environment they're in and what the people are choosing to do with them and what diseases pass between the animals and the humans is all important to the medicine in that context. So, I mean, that's sort of where I started in One Health. It was certainly before anybody was calling it One Health. It was sort of just, that's how you do medicine in these populations. But I think when I came here, maybe around 2010, I started hearing people use the term One Health, and I was like, yeah, that totally makes sense. That's what I do. So yeah, it was not a journey to get there. I feel like I've always kind of been there.
Working. Okay. So good morning, everyone. First, it's a great pleasure to be back in Ohio 3 years after this crazy pandemic. So my journey, after graduated in Pernambuco, I went to the residency actually in Clean Path, but I was in a city that is endemic for visceral leishmaniasis, and I didn't have a clue about One Health. So the first time that I really heard about the term like One Health approach was in 2011 when I met Dr. Gebrayes and start to help on the organizational alcohol. And since then we start working on that. So I have been teaching zoonoses since 2011, and things are growing. So, and nowadays it's important that we don't have to explain anymore what is One Health. That is the only good thing about the pandemic. Although we have to still fight and hold the flag of One Health. So, yes.
You at all.
Yes.
So good morning and good afternoon to our remote viewers and listeners. Perhaps my advisors and as an undergrad and grad school, 2 different universities where I earned my degrees were prophetic, but they knew I was interested in becoming a generalist. I knew nothing about One Health, 40 some odd years ago, 50 years ago almost. But so fast forward, I think most people on this campus and even beyond would say, what is your connection? Where did it begin? They'd probably say Dr. Wandison Gebrayes, who's the executive director of the Global One Health Initiative. And that was my story. So it goes back to my arrival in 2009. There was a proposal to NIH for a capacity building program. Things evolved from '09. Various activities, the first One Health Summer Institute, I think in 2012, released a leadership in Tanzania, and then it's continued to evolve and expand from there. And in 2016, we formalized and became the Global One Health Initiative. So I'm an environmental and occupational health specialist, focusing more on the pathways to human exposure. But by virtue of being a generalist by design, which makes me somewhat of an anomaly, it's a high risk to take as a PhD. But once I learned more about it, it seemed like something that would certainly fit with my interests and aspirations.
There you go. I think that worked. Hi, everyone. Thank you for having me. I would say my journey started within One Health when I was in my residency training. I did a global health certificate program, and so I was looking for a place to go for my global health elective. And I knew I wanted to go somewhere that wasn't just a, one trip and done and never see them again kind of thing. And so I did a lot of research in that area, talked to some of my mentors, and I found a place in Indonesia that works with a nonprofit international organization called Health in Harmony. And it's a really amazing program where they are located in a clinic at the base of a national tropical forest, basically in West Kalimantan in Indonesia. And their approach was really that planetary health approach. So not only human health for the community there, the villagers and the surrounding villages, but also the planetary health. How do we stop deforestation and improve that the planetary health in the area, the environmental health, and really a lot of educational efforts on that link there for the community. And so that was my first experience there, and I learned a lot, and it was really meaningful to be able to make that impact. And so through that, I really saw the impact and the connection that you can make with One Health and planetary health. And so since then, I came back and I've been involved in a lot of different things. I think through education and collaboration, we can really make a lot of impact through One Health. Thank you.
I will, my connection or tie into One Health really did begin with Wonderson. But as I've been thinking about this question, I see that there's been various parts along my path that I bumped into it and didn't realize it. All the way back to growing up in Ireland, my dad was a pharmacist in a small town. And I used to be really curious as to why these farmers would come in and talk to him about his cattle and the illnesses they had, or women talking about the problems with the chickens. And yet he seemed to have answers which just didn't seem to fit with pharmacy, a human-centered thing. And so I studied pharmacy and ended up coming to Ohio State to do my PhD in natural products chemistry. And again, there you've got the source of potential human drugs in plants. And that really was where my interest in ethics started, because some of us in the lab would ask, well, where are these plants coming from? And in those days, it seemed to be, you sent a couple of botanists to the Amazon, they gathered up bags and bags of material and brought it back, and hopefully somebody made a profit somewhere else. And some of us started asking, well, is there some ethical issues here? And what does that mean? And how do you look at that? So that started my interest in ethics, and I moved from focusing on the science of pharmacy to the ethics of healthcare, and kept a tie-in with pharmacy through involvement with the Cochrane collaboration, which gathers evidence around healthcare interventions. And when the disaster in the Indian Ocean, the tsunami, hit in 2004, Cochrane was asked for evidence around disaster responses. And they had to say, well, unfortunately, we don't know if there is much. And they, as a result of that, initiated a big push to do more research into healthcare responses in disasters. And knowing of my interest in ethics, they came to me and said, could you do some sort of an overview of what are the ethical issues if we want people doing research in disasters? And so that started my interest in kind of disaster settings, humanitarian settings. And then when I came to Ohio State a few years ago, Wonderson introduced me to the element of working in those sorts of environments in a One Health approach. And I've really made that a big focus now in terms of as you're doing One Health research, what are the ethical issues, both in terms of the research itself, but then also as you start to get into how do you balance the priorities of the benefits of the humans, the benefits of the animals, the benefits for the environment. And there's some really challenging and difficult questions that really need examination. And so it's opened up, I think, a really intriguing and fascinating, but also I think very important area of ethical inquiry.
Absolutely. So I feel like every time I ask this question, in many contexts, COVID is the first response. So maybe if we could balance our COVID experiences with other experiences, I'm hoping that you can each walk us through your recent projects or some activity that you feel has really integrated your One Health experiences. And maybe you could start first. We'll go back down this way.
I guess you've got to keep holding it till it says, okay, I'll cooperate. So we, through one of Wonderson's projects, I guess it's right before COVID, we got a small project funded to really look at issues around the regulation and the ethical issues that are being reviewed for One Health research. And it was through that we did some kind of general survey and planning to do some interview research, but really seeing that many of the scientists are well aware of deep, challenging ethical issues, but are not sure where to go to really address them or to really get help to work those things through. And so these challenges spread out into the practice of disease outbreak responses and public health responses in the veterinary world, where you need to interview people in the community, but you also need samples from animals and from the environment. And with an outbreak, there is always an urgency. So do you kind of just push ahead and do what you think you need to do for the benefit of the broader public and the long-term interests, or how do you back off and respect local communities, their right to make decisions about what's going to be done with them and with their animals, their crops? And so we have a team working in Kenya and Ethiopia, really looking at these and these types of questions. And of course, COVID adds a whole other layer on top of that in terms of, the risks that people are put into in terms of health risks, but then also add in conflict issues. And it just makes for this whole collection of challenging issues that people on the ground are wondering about, thinking about, maybe staying up late at night, asking themselves about. And part of what we're kind of hoping to do is be able to provide the tools to think through those things, have discussions among the research teams, and overall become a very ethically sound, or have an ethically sound approach to doing the research.
Right, we just have to hold down a little bit longer. I'll just mention three things. So one, Buckeye Pause. Recently, I know it actually started before the pandemic, but I will say that with the pandemic, I think the value has just been even more so. The need and the value has been even more. So Buckeye Pause is a animal-assisted intervention where we use a therapy dog program to do visits, and really with the focus of improving the health, the mental health, well-being of. It started in the medical center of healthcare professionals, but we've since expanded into the university and for students, faculty, everyone else, and we're actually studying the impacts of that right now. So that's been something I think recently, and then. Another thing I wanted to mention was our involvement with the Global One Health Summer Institute. And I will say, as you know, this is something that's been ongoing for many years, but only just recently, the past three or 4 years or so, we've been doing the internal medicine series where we do a training series for our colleagues in Ethiopia. And I'll say that even, with the challenge of the pandemic, I think it's actually been a silver lining because in the past, doing it in person might have caused some barriers, some challenges for faculty to actually be able to travel over to Ethiopia. But with the advent of, even more the digital world that we live in now, it's posed a great opportunity actually to have a lot more collaboration and be able to have our faculty participate in this series and to share with really a lot more people around the world. And then the third thing I just wanted to mention was the new Global Health Scholars Program that we're building for our residents and launching soon. So I think a lot of this, I mentioned education before, but I think a lot of the impact that we can make is through education, through our learners, from every step of the way, from early on in training. And so in the development of this program, we're really trying to break down the silos between different medical specialties, provide this education and curriculum for residents who are interested in global health, and also to introduce that concept of One Health early on within their training. So, thank you.
So as an extension of being a generalist, I'm involved in a little of a lot. So sort of across the spectrum of various activities, I think the one that's the most obvious is the summer program and the Global One Health Summer Program. So for this past summer, as an example, a team of 3 of us relooked in the format, the content, the types of courses, the modes of delivery, et cetera, for the Global One Health Summer Institute, which is now a decade long of doing it. It's been a very successful program, typically housed out of Addis Ababa, but not exclusively. And with the addition of Zoom and virtual connections, it's now worldwide. And so that's probably the one that's most measurable. Behind the scenes is, again, my position is going through a morphology change, if you will, and then at this point, but from an advisory side, I've conceptualized a behind the scenes integrated laboratory concept that I think would be critically important as part of the next step. But there's a lot of work that needs to be done.
So it's hard to pick one big project, I think, because, for example, I'm from Brazil. So Brazil, relying on the biome that it's like we have 5, 6 different countries. So and you see, okay. So I was talking this morning with one sense. So it's hard to get a One Health idea and replicate in another country or in another area. We have a lot of variations, but if I have to say one aha moment is that every time that I discuss a project with my Somali partners, the Gambia partners, or Brazilian partners, I figured out that I'm still a student. So we don't have a clue, and if you are alone or two vets, and then I bring Mike, and then I bring. So this is the beautiful thing of One Health, because after COVID pandemic, we start. Okay, I'm a father, so we keep thinking on the kids, and when you figure out that there are some places that really need improvement on basic things. So this is where we have to burn our mind to keep going. Okay.
You just need the magic touch. Yeah, so I, like everybody, there are so many ways that you get One Health experiences, but the most relevant thing that I can think of now is I've just started working on the guinea worm eradication project. It's been almost a year now. So guinea worm is a disease that was formerly thought of as being a human disease, but in the final stages of eradication, as folks often discover, they discover that there are some animals involved. So they've had to kind of rethink the eradication program and include veterinary knowledge and animal knowledge. And it's been interesting to be kind of at that juncture where a group that's only been thinking about humans is now expanding into One Health. And maybe some of the people will be watching the video here, but they have a project that's going on. It's a research project that I'm involved in, and they have amazing logistical support on the ground. So they have teams that go into the field to do some research work every 3 months. And it is just amazing to see the teams that they've assembled. So the last time I was in a team with someone from the Ministry of Health, someone from the Ministry of Livestock, people from Livestock Research Institute, not ILRI, ERED, but, and, you know, having me, I was the data specialist on the team, but it was amazing to watch One Health in action in that team. There would be a question about something that the Ministry of Health had been doing, and there was the Ministry of Health person there who could answer that question. Someone would come in with a question about livestock, and the person from the Ministry of Livestock would answer that. And just the way those teams functioned so perfectly together to get this work done. We just keep talking about how we hope in the future that these teams can be repurposed to do additional things after we've eradicated guinea worms.
Well, I hate to transition from such extraordinary work to challenges, but I think sometimes we learn more from those than we do from our successes. So Dr. Bisesi, I was hoping maybe you could start and share with us, I don't know, some time or space when there was a stumble or things didn't go as you had expected, or something, a moment when you had to rethink the strategy that you were tackling.
I think I'm innately drawn to challenges. That's why I've been an academic administrator for 31 years. But so foundationally, you know, I'd like to talk about challenges relative to science, and there's a lot of them, but foundationally, there are challenges of just awareness. There are challenges relative to bringing all the people, places, and things together to truly integrate and have a robust One Health approach. And even how it's framed out, right? The original paradigm was focused on infectious agents, primarily zoonotic infectious agents, and the related infectious diseases, which remains critically important, of course. We've broken beyond that paradigm to expand. And there's moments when I think maybe we move too fast, because just getting the teams together to focus on the original paradigm of infectious agent, infectious disease, bringing together the multidisciplinary teams, because as human beings, there are a lot of cynics out there, right? And you run into barriers, and really if you look at the history of One Health, the profession that really deserves the credit is veterinary medicine. It really evolved out of veterinary medicine. But if you even look at the education and training in veterinary medicine, they're learning about animals and humans simultaneously. Humans because of the impact of zoonotic disease, humans from the impact of quality of livestock, and you know the rest of the story. But breaking through into human medicine, breaking into when we say environment, and that's a whole nother issue. And if you were listening carefully at the introduction, you heard Dr. Gabrea say the interface of human health, animal health, and environment, and he stopped. That's what you should do. But most people say human health, animal health, and environmental health. Well, environmental health is a profession. And it's a profession, it's a specialty of environmental science where we not only look at the contaminants in a certain matrix, but then try to answer the question, are there pathways for exposure? And the focus is on humans, and I'll talk more about that later. But just the awareness among the professions that need to be involved, right? So plant pathologists, wildlife biologists, right? The full spectrum. So it's not just veterinarians focusing on the animals, not just physicians focusing on, and it's not just environmental health specialists focusing on the environment. It's a broad spectrum. So building these robust teams. I mean, even here, we're proud of the diversity, if you will, in terms of education, training, perspectives that have been brought to the team, but it remains a work in progress. But so that's, to me, one of the biggest challenges. If we're really going to launch this approach, then we have to find a way to accelerate the awareness so that we can neutralize the cynics. They see the value of this, and we can truly integrate and bring all the, as I call, resources in the form of people, places, and things together to make this effective.
Dr. Garrett, he threw the opportunity to veterinary medicine. So I was wondering if you could let us know about some opportunities, some challenges that you have faced, and maybe when there's, been assumptions or resistance that you've had to confront.
There we go.
Yes.
Okay. All right. So I mean, when I was thinking about this question, doing One Health work, there are always small challenges and big challenges. So, I mean, you were talking about getting things and people and like just the logistics involved of how do you ship whatever from whatever place to whatever other place it needs to go is a tremendous challenge. And then the little challenges of, being in the field and, encountering somebody who is very against the purpose that you're there, and then trying to talk them through, well, what is the issue? Do you understand what I'm doing? So those communication things, again, those are like small challenges, getting stuck in the mud, all that fun stuff. But then there are these kind of bigger theoretical challenges. And I wanted to kind of use an example to talk about this. I was talking to a conservation medicine veterinarian kind of back when I was first learning about One Health. And I was saying, she was talking about all these problems that humans were causing in conservation medicine. And I said, but we care about the humans, right? And she said, well, do we? And then I was kind of talking about some of the similar things, like maybe 2 months later with an MD microbiologist. And I was saying, yeah, and like humans are kind of the problem. She's like, but we are humans, right? Like we're important. So I guess the challenge for me is this kind of confluence of humans are the problem in a lot of cases, or we have a solution and we need to convince people something, or we really need to understand what the people are doing and why they're doing that to address the challenge in the broader One Health context, right? Because the human puzzle piece for me is always the biggest challenge as the veterinarian. Like I can trap wildlife, I can inject livestock, like that's easy. But people, man, they're such a problem. So I guess that's always my large scale challenge of working with people who have so many different ideas, and we have the power to address all of these things, which is one of the wonderful things of One Health, of, you know, the people can come together and can really do something here. But again, it's kind of getting everybody together behind something that is the challenge for me. And I mean, that's, I think that will always be a problem.
Well, Dr. Clark, you deal with little people who will live with the ramifications of that which we do. And I think the short-sightedness of adults must get as frustrating as it is when we're dealing with animals. But I'm curious, from your perspective, what are some of the biggest challenges that you've confronted?
Yeah, I think that made me laugh. You're right. I mean, people, because you made me think of when you mentioned, you know, people and trying to, you know, have people with different priorities, people with different, you know, perspectives. One of the things with that group with Health and Harmony that they did that I thought was really amazing was what they call radical listening, where, you know, you literally talk to the communities and really listen, like what are the needs, and, you know, and then come to hopefully a common solution. And I think with all of this, you know, competing priorities within One Health, different professions coming together, yes, that certainly is a challenge. But I think when you peel off all of those layers and you get back to, okay, what are our common goals? I think that's where the solutions can kind of come through. Some of the challenges, you know, I hate to bring up COVID in, but I think, yeah, definitely, certainly, you know, COVID has been a big challenge in the pandemic recently, in regards to resources, in regards to people's shifting priorities, in regards to, you know, limitations with traveling and so many things. And so I think that has been honestly one of the biggest things. But again, I think the way I look at things, and maybe I'm just more of a positive person, but I always try to think of, you know, what are the positive things that we can take from this. And so what I mentioned earlier about, you know, the opportunities for more collaboration with the digital world, with, you know, maybe having a common goal if we're fighting towards the same thing, or we have maybe similar problems with the pandemic and things. So that's the way I kind of, you know, I see the challenges, and then I try to look at, you know, the positives or the silver linings from that.
Well, and since we are going to talk about COVID, Dr. Omethun, it feels like nurses and frontline workers were subjected to the stress on all of us was augmented by that particular population. And so from your perspective, what were some of the challenges that were faced in terms of trying to approach One Health in the midst of a global pandemic with the people who truly were on the front lines of trying to keep people alive?
Well, I think the challenge is obviously, I guess, that researchers are human, and that is a positive thing that we need to recognize and encourage them to be human and humane as they're doing what they're doing, whether it's frontline work or research or teaching. And I think what has become clear, certainly with the research we've done with nurses, is that how they approach what they see as the ethical challenges is something that they have felt very unprepared for. And I think all professionals are trained in ethics, but I think part of the problem is that, and I guess I'll kind of not bash my own profession, but critique it a little bit in that we've often taught ethics as something that you've got a challenge, you've got things you're trying to weigh, and if you just approach it in the right way, you'll get the right answer and feel really good about what you're going to do. And what's been very clear in COVID is that there were no good answers for many of the dilemmas that people were facing, and yet they hadn't been prepared for patient scenarios where no matter what is chosen, people are not going to survive. People are going to feel bad about every possible decision they could have made. And then I think as your work is doing, it's like, well, then how do you support the people who are then left to face all of that aftermath is something that's been really lacking. And interestingly, I think this is a place where humanitarian work and work being done in other parts of the world can really contribute to Western well-resourced approaches to things, because in humanitarian settings, having to make these tragic decisions is everyday medical and veterinary and public health practice. Most of the world is still living where they don't have enough medical resources to do the basics. And those practitioners have had to learn, how do I cope with the fact that if this patient was in Ohio, they would go home with a prescription and be perfectly fine in a week. But here they're going to die no matter what they do. And so there's a lot of learning that I think can come from other parts of the world where we may have thought of them as the parts of the world that we are going to go and help. They have an awful lot to offer us. And I think One Health promotes that perspective that this is a partnership between different countries with different traditions, different strengths to ours, and we need to learn from them. So I think that's where we can learn a lot when, you know, we now have to face the reality that we have been living in a little bubble thinking we've got, you know, resources to cover everything. Most of the world doesn't, and they've, you know, been learning how to cope with that emotionally, relationally, and developing the right sort of community support to be able to help their frontline people.
Not at all, at least Dr. Vieira. What kind of assumptions do you think that have been refuted for you, and how have you kind of coped with the idea of your shifting assumptions?
So I'm thinking on what Rebecca told about the people. So I have the lab on my DNA. So I was listening the answers, but thinking on a way, okay, I have to design every time that we want to implement like One Health in a place, we have to at least have a clue of what is happening on that place. Okay. And people is a problem. So, for example, we worked in a project that Laura is helping us. We are working on wildlife samples from the wild animals that were burned in Pantanal. So I have to use logistics there. But when I jump to Somalia, and we have the humanitarian places, so we have to handle a situation where we have an outbreak of Rift Valley fever on the border of Kenya, and I have to send students there to blood sample. But we know that on that area, we have Al-Shabaab bases, so people again. And then if I jump to the Gambia, we design a project for cattle sample, but they don't have electricity. So how do we store samples and ship to us? People again. And then you say, okay, what I can do is not what we have to do, is what we can do. And when we think about shipping and handling of animal samples, so, and we have to congratulate Go High for that, establishing reference labs in Ethiopia. I think it's we really need to invest on the basis. If we don't have the ways to do it, we will not figure out what is happening. So.
Well, I want to keep on this theme of people, which they're so problematic. And the questions I'm going to ask now are a little bit more tailored to your expertise. So I may throw it to one particular person, but I'd love for as many of you as wish to engage in this particular topic. And if there's other things that come up for us to continue to talk about this. But Dr. Vieira, I'm going to ask you to start thinking about the idea of surveillance, in humans and animals and environments. It's such a critical part of disease prevention and response, and it's something that GoHi is so significantly involved in. But what are the limitations of disease surveillance systems?
So I will start with the places. So imagine it is so hard to blood sample, storage that sample properly, and bring that sample to the reference lab. This is the first one. So we know that, for example, I will give a big issue for us. So everyone knows about FTA cards. So they feel very reasonable. It's just a drop of blood shipped to a lab. But when we start to processing, we can clearly see that this is not right. So this is a big issue for us. And another thing is that standardization of protocols between labs. So if we run a PCR here, or maybe in 4 labs, we might have 4 different results. So this is another big issue for us, and a terrible limitation, because we cannot make the same assumptions based on only that lab data. And when we read a lot of publications asking for data sharing and so on, but imagine how can a colleague of mine from Nigeria could share his data, since he only have internet access for such a period of times, and the internet does not allow you to upload big data. So it's so many variables when we forget the humans. So that is for me now is the big limitation.
So a big area. So again, GoHi underpins almost every institute and center here that has something to do with health. And so when I'm represented in Infectious Disease Institute, Global Water Institute, Sustainability Institute, I'm not representing just public health and environmental public health. I'm representing the One Health aspect, because it's all linked together. And so I think part of surveillance that I find to the point of frustrating is there aren't the resources and money, right, to really do surveillance in an integrated, coordinated way, right? Wouldn't it be great if we're truly looking at that interface to have a very structurally randomized, that systematically randomized approach to surveillance, where we're collecting environmental data, whether it's air, water, soil, or food, or all the above, animal sentinels in those areas, as well as human surveillance data, simultaneously processing the samples and having integrated output. Because then you're actually looking at the layers of bait and transport of the contaminants. Is it animal to human, human to animal, or is it just environment to both human and animal, right? All those pathways of exposure. And then does that exposure, and those are all hazards, do those hazards have an association with higher disease risk? And so we're not there yet. But even going back to something Rafael mentioned in his example, is the distinction between presumptive data and confirmatory data, and the absence of quality assurance, quality control. And quality assurance isn't limited to the laboratory, quality assurance, quality control begins before you even collect the sample, whether it's from a human, an animal, or the environment, because it brings you back to what are the methods, what are the techniques, what are the instruments, how do you ensure that you're not using sample collection instruments or equipment that's already contaminated, right? That's quality assurance on the front end. And so that's lacking right now. The word that comes to mind almost every day and almost everything I do, two words: deliberate and integration. And those are two words that One Health needs at this point, being more deliberate about what we do and truly integrating what we're doing and making sure that the data are meaningful. And so if we have limited resources, I feel there's even higher responsibility to make sure we get the best return from the limited resources.
It just turned on as I moved it. All right. So when I think about surveillance, you know, I'm always coming from the data side. So it's a sample size problem, kind of like how many do you need to sample to understand what's going on? And when you have different species and matrices and different time periods, how do you optimize that situation? And it also comes in a lot of times from working with people on the data analytics side. They can handle massive amounts of data. They say, well, you know, let's just get it all. We need everybody under surveillance. And you get into these issues of privacy and issues of, you know, surveillance from the like spy kind of perspective versus surveillance from the disease perspective. And kind of getting the optimal solution there is a huge challenge. Animals don't really, you know, have privacy. So animals are relatively easy to sample from that ethical perspective. But having massive data streams in some settings is very possible. It's just a question of what do you really need and what are the ideal samples to take, like allocation of resources that I think looking at those under-resourced locations might be very informative of, you know, what are the optimal things to track. And shoot, I wanted to say one other thing there. I have forgotten. Yeah, I'll leave it at that for now.
All right, well, I did want to invite everyone on our next question. We have a QR code that's going to pop up for those friends who are online with us and those of you who are in person. And so we do want to get your comments on some of these topics. So if you would be willing to take out your phone or your tablet and scan that QR code, then you'll get the opportunity to contribute to the discussion that we're having, which I don't want to end because it's been amazing. I was going to throw this to you, Dr. Carbit, but I'm gonna let you off the hook from the human, the people standpoint. And so, Dr. Clark, I was hoping maybe you could start us on this topic about One Health is often seen that saving people's lives is the most important thing, but should it be? Is that the end all be all of what we're doing?
Yes, I guess as a physician, that is the goal, right? Taking care of people. But I think it's all interrelated, right? We cannot just take care of human health without taking care of everything else, because it's all interrelated. And I think that's part of that focus. That's the whole concept of One Health and the work that we're doing here. So yeah, I'm curious to see what our audience thinks about that. And yeah.
So it's a great question. It's a question should be asked, but I don't think we should spend time outside of this conference debating that, because the reality is it's ironic even to debate that, because if it's truly One Health, as what was implied here, they're all commingled. And it's a challenge because the reality is animals and plants would be just fine without humans. You can't say the reverse. We're so hyper reliant on animals, right? As part now, the vegetarians would, debate that, but the reality is, if you look at worldwide, so to me, it's not relevant. What's relevant is, what's important is One Health is important. And that's all it is, because everybody will gain, all forms of life, humans, non-human animals and plants will all thrive if eventually at some point there's truly an embracement and implementation worldwide of robust One Health approaches to this.
Dr. Amundsen, one thing I am curious about, we talk about animals, we often use the phrase quality of life, but we actually don't seem to use that as often when it comes to humans. So when we look at the One Health approach, how do we integrate this idea of quality of life within the approaches that we're taking?
Well, I was thinking about the previous question as well, and had maybe some of Mike's same kind of reaction to kind of saving humans, and was thinking about what I'd rather talk about or rather see as the focus would be the word flourishing. And that maybe gets at part of what you're saying as well. How do we promote the flourishing of humans? And I think you can't really do that without our environment and without our connections with animals and plants. And I've probably watched too many science fiction movies, but you could save the human race by putting a select few on a spaceship and send them out into space, and the Earth gets blown up then. So you've saved humans, but I'm not sure if there's going to be much flourishing on a rocket that goes for however long it can go. And I think that's really an emphasis that needs to get back into all of this discussion about how you balance things. Can you flourish by having, plenty of money, but you're destroying the environment in order to get that, and you're subjecting some part of the population so that a small group can have all of the wealth. And that's where I think, ethics is integral to this, or at the very least values around what does it mean to flourish? How are we healthy, not simply in our physical bodies, and that applies to environment and animals as well, but actually flourishing in terms of our relationships, spiritually, our connection with the environment. And that certainly is a much bigger challenge, but I think it even broadens One Health beyond the scientific realm into the broader social and relational dimensions.
I do want to bring it back to you, Dr. Carabin, in terms of how maybe our policies and One Health practices could evolve or change to make animals and plants and ecosystem health more of an integral part of what we, even as much as we help people understand why they need to be an integral part of what we're doing.
So I'm not a policy person. So, I mean, I think one of the questions on here is the concept of zoonotic diseases. That's sort of where some of this started, but I think the idea that there's, disease out there in the animals and it comes to people and that causes problems for people is sort of a harmful way of thinking about it. I think the idea of interconnectedness and multi-species transmitted pathogens and all species kind of participating in the same ecosystem is probably a better way to think about it. I realize that's a complex concept that doesn't always translate very easily into policy. But I think it's important to kind of get that message out of it's not animals, humans, environment, it's all of them interacting together to flourish. And that's sort of the one welfare concept. And yeah, I mean, I know this panel was kind of framed about pandemic and informing the future from pandemic. And there have been a lot of pandemics that just haven't involved people. And there's a lot of experience from other areas, from plant pathology, from livestock health, and lots of opportunities to practice this sort of thing with pathogens that don't directly impact people, but that kind of proceed in the same way. So I think there's a lot of knowledge between fields that still can be shared. And certainly when we talk about building up laboratory capacity and surveillance systems, reducing boundaries between groups is key.
Well, forewarned, Dr. Vieira, I'm going to put you on the hot seat here on zoonotic origins and pathogens. But before we do that, we're going to, I hear, get the responses to some of the comments that we received related to this previous question that we just had.
Yeah, so from our audience, both in person here and virtually, they seem to agree with the panelists that there should be a more holistic viewpoint on One Health and the endpoint, not just being on human lives, but more holistically on livelihoods, as Dr. Omathuna mentioned, and flourishing of human lives, and really thinking more holistically about that human, animal, plant health, ecosystem health as being an endpoint. Essentially, human lives are important, but thinking more holistically about that seems to be the consensus online.
So Dr. Vieira, how does the conflating of, zoonotic origins of pathogens and One Health challenge our understanding of disease within the One Health framework?
Is this stuff? It's so complex because I'm thinking here some patterns, but we are facing a, for example, let's go to the practice. We did a study in Somalia. We evaluated 400 pregnant women, and we realized that almost 40% had a history of abortion. And we don't know what is happening there. We thought on some Brucella, Toxoplasma, and Campylobacter, and so on. But when you think on the Somalia, let's say, behavior, they have sheep and goats as pets. So this is one behavior. And if we go to Brazil or here, our dogs and cats sometimes take us from our own beds and so on. So this is complex. And when you bring, a physician to talk, a nurse to talk, and a veterinarian, and try to overlap the thinking, might help, but in general, it doesn't.
Mike, you want to jump in on this? I have another question for you as well. You want to answer this one, Dr. Bisesi? No, he's thinking. Certainly. I think what we're trying to determine is how the conflating of zoonotic origins of pathogens and One Health are challenging our understanding of the causes of disease within the One Health spectrum.
So again, One Health originated around that paradigm, as I mentioned earlier. And so it's complex enough. And so the paradigm right now, I mean, the example just given, you didn't hear environmental health being part of it, because the assumption is that it was of zoonotic origin. It may have nothing to do with an infectious agent. It could have been a chemical agent, right? There are chemical agents that will induce abortion. So the complexity of it is already just focused only on infectious agent, infectious disease is complex enough because of the myriad of possibilities. But when you throw on top of it that there could be other factors, right? There are studies in wildlife that excessive light will be from urban light and wildlands adversely affects reproduction, right? And noise pollution adversely affects, wildlife. So there's a lot of moving parts and pieces to this. And so that's the challenge I have in my own mind. If we're not even in the best place yet relative to the foundation, the foundational focus of One Health of infectious agent, infectious disease, are we too ambitious to try to throw toxicology into the mix? And I'll give you a different answer every day. But when I'm absolutely practical about it, it seems maybe in the immediate future, we need to focus on the original paradigm of infectious agent, infectious disease, not abandon the other factors, but let's see if we can get it right and catalyze all the people, places, and things that need to be part of that infrastructure to improve that. And that becomes an exemplar, the model for the broader aspects of now building in toxic chemicals and harmful physical agents, whether it's toxic radiologic agents, toxic non-ionizing agents, sound, light. There's multitudes of confounding factors.
We're going to continue this conversation, but I do want to remind everybody that there's a QR code up and we really want to hear what you have to say and we want to be able to engage you in this conversation. So while we're exploring this a little bit more, if you would just take a second, pull your phone out or your tablet and give it a scan and just type your responses in. We would love to hear from you. Absolutely.
Okay, so you bring up this idea of these very, very complex situations that you get into when you have kind of multi-species in different environments and different potential causes. And this is where I like to bring in computer models, because sometimes you can take this complex system and pull it into a computer in a simplified way and try out different things. And I was just thinking about my students in the computer modeling class, and we have them work on a theoretical simulation of infectious diseases in humans and animals. And it's really interesting to watch them because I say, okay, here it is. Here's this situation you've got, and you can see that the animals contribute to the disease in humans. If you take the animals out, okay, you don't really have a big outbreak, but if you put the animals in, now you have an outbreak. So, all right, find me a solution, right? Try different things. What is going to reduce this impact? And I ask the students to think about it of, which things can you change in this equation? And I think it's always exciting to watch the couple of students who try things that are not intuitive. So they're like, well, we'll just decrease transmission between humans and animals, or those are ones that they always think of, or some people are trying to, treat the people. But the way the simulation is set up, if you make the animals live longer, you actually fix the problem. I hope I didn't just give anybody the answer on their homework, but so I mean, sometimes there are these elegant solutions that are not necessarily intuitive, but when you think about the whole system, you can find something and it's like, oh, that's not that hard. So anyway, so there's some positives to having these complex situations too.
And Dr. Clark, I was hoping maybe you could help us see from your perspective, what can we do to expand this really narrow approach that I think a lot of people have that says that One Health is basically human and zoonotic, and how do we get them to see this 360-degree view of all aspects of One Health?
Yeah, I mean, I think it has to do with education and making those connections. I think when we go through medical school, we learn, here are some risk factors. These are the risk factors for this disease, this cancer, this malignancy, this, all these different things. And so you learn early on, I think, to try to start making those connections. But I think as we've kind of talked about, those connections are even I feel like there is a lot of still opportunity there because I think when the current education is, yes, you learn these risk factors, these are the buzzwords you learn on the exam. And then, when you see patients, these are the textbooks things that you see. But in real life, it's a lot more complicated than that. And there are a lot more, different things that may affect that we don't even know, that there's still a lot of research that needs to be done. And so I think it gets back to, exposing students early on the concepts of One Health and maybe more, instead of focusing so much on, these specific things. And yes, that's important too, but the concept of One Health, because as more research comes out in the future, as we're starting to learn more, whether with simulations or other things, then those ideas the foundation will already be planted, and it will be easier to kind of understand and integrate that into practice.
Jonathan, what are your thoughts?
Yeah, I was thinking about maybe drawing the circle all the way back around again in terms, you've got the infectious agent, the animals, the humans, but also adding back in there, well, why is it that we're having these animals doing what they're doing now, or that coming into contact, and raising those bigger societal questions about the increased urbanization. So what about the role that our behaviors are making in, promoting the environment, making the environment suitable for this type of physical transmission to happen, and then raising questions about issues like justice. So why is it that, in certain parts of the world, urbanization is seen as the only answer, because things are happening in the agricultural lands, because the forests are being torn down, or whatever all those other factors are, and showing that this is not simply a virus has decided to mutate and pop into another species. Human decisions are being made all over the place that are having huge consequences. And that then we need to go back to looking at the values that underlie those decisions, and why some of those big types of things are happening. And, none of them have easy answers, but they need to be considered. And I think that helps us then to broaden it back out that, again, this is not just a physical anomaly that we need a physical answer to. It's much bigger than that.
And Dr. Bisesi, it seems like, I don't know if it's lost in it, but we don't necessarily talk about planetary resiliency in terms of the importance to One Health, because there really is no One Health if there's no place to put it. So how do we kind of recognize the role that One Health plays in improving planetary resilience?
Thank you. Okay, that's embarrassing. Anyway, so again, it depends. I'm not known for my patience, but I think it's almost like a need for a reset and the concept of being deliberate again. So where can we best use our resources? And time's an incredible resource as well. So where can we show up? What types of committees, locally, state, nationally, internationally, should we involve ourselves in, where we can have these conversations? It's part of the awareness. But one of the challenges, like every emerging profession, is coming to an agreement on lexicon. So even in this profession, right, and I don't say this critically, you use ecosystem. So even the accrediting body of public health defines One Health as human health, animal health, and ecosystem. Guess what? Humans and animals are part of the ecosystem. It's environment. Environment underpins everything, right? Whether it's an indoor environment, an outdoor environment, wherever you are, it's an environmental setting. This is the environment. This room is a specific environmental setting. It's a space within a place, a building, and the building is a part of a broader environment. And the ecosystem is everything that's growing in here, all the people, all the animals, that's the ecosystem, right? So it's a challenge. And so I really think it's where Go High has the advantage in our colleagues internationally is we try to hit this bi-directionally. So we show up, we have representation on committees that can make a difference at all levels, local through international, but simultaneously really be deliberate in our grassroots effort to build the model. And, you know, we've made progress there. So there's building a model, which I don't think we want to abandon. I like the paradigm we have in which we expanded. We added plants to the paradigm. So human, animals, and plants. And then you'll hear people argue, but plants are part of the environment. Well, so are animals and humans. So again, but if you look at life, categories of life, humans, animals, plants deserve to be in there. Right, I'm in a program right now at the university, and the plant pathologists are a group, and they call themselves the plant doctors. Good for them, because that's what they are. So, so being deliberate, having the broader paradigm is okay, but then you can build a very strong model. The question is, are we able to implement it and sustain it? And that's where, again, it brings us back to resources of people, places, and things. And things covers a lot of ground. And one thing is time, money, those types of approaches. But the short answer to your question is we need to hit this bi-directionally.
Great. And I understand we have some more answers from our QR code.
We do from our participants. We're hearing that, yes, resoundingly, we should be expanding the viewpoint of One Health beyond zoonotic diseases, that it is being conflated, not necessarily to the detriment of One Health, but there is opportunity for expansion. There is a comment here about the emphasis on funding mechanisms on zoonotic diseases. And so the need originates from that funding resource. And then there's also a mention here about the consideration of trickling effects that are not only on the occurrence of disease, and then some mentioning about focusing on non-communicable diseases, as that's becoming a huge impact on society, particularly in the recent events that we're focusing on in today's world.
I think that's a perfect segue for us. And I mean, these last few questions that I'm going to have are for everybody. So get ready. Dr. Garabin, maybe you could start us. I know. Where are we going? I mean, how do you think that One Health is going to change in the next 5 years, 10 years, 20 years?
So I think it's out there and we're going to be doing it. I'm somewhat pessimistic about funding directly related to One Health. I think people are people and they kind of care about people. But I think it's an undercurrent now, and there's going to be a core group of people who kind of keep that going. We might end up being more of a niche, but I think it's going to be a very influential niche that will kind of rub off on all the stuff going forward. But I don't know that we're ever going to have, you know, like the office of One Health, and, you know, all of our health is managed together. I don't see that happening. But again, this is the crowd that maybe are going to prove me wrong on that. Yeah.
I think that it will be directly related to where our politics will be, because it doesn't matter if we created big academic groups, build excellent plans, but when we go to each particular places, they put a person that doesn't have the knowledge to apply that. So I came back. I arrived from Brazil yesterday. We had the elections and so on. So we are on their hands. It doesn't matter what we do or what we are gonna do. because we just finished a pandemic. Are we ready for the next one? If start next week? No. So we are doing the basis on each of our expertise fields, but at the end, we will rely on them. There is no.
But the question is, how could we be better prepared for the next one? As we had a more integrated, more robust surveillance approach and integration of the laboratory infrastructure as well. To me, that's doable. That's an application, which is, I feel, a higher probability that we'll see things like that than seeing a CEO who oversees veterinary medicine and medicine. I don't think that's ever going to happen. But initiatives that come out of it that follow the One Health approach, I think are very achievable. I'm very optimistic we'll see a much more robust integrated surveillance approach, which in corresponding to that is both the field sampling side, the epidemiology behind it, the laboratory data analysis, and descriptive data, predictive data where modeling comes into play as well. And so that's what I think will be a reality at some point.
Yeah, I agree. I think the whole concept of One Health has, I mean, I think it's kind of undeniable, and it's the world that we live in. And I think it's a whole nother question in terms of resources and funding and politics, of course. But I think the value is there, the integration, the breaking down silos, the, people talking to one another. And then again, the underlying, educational efforts, I think will come. And I think all of that will come. I mean, with anything, I think change doesn't happen overnight. We're thinking, this is thinking big picture. And so the more that we talk about this, we have venues like this, we talk to our learners about this and they understand the concepts and we do research in the area. I think that's the direction that we're headed in.
Well, I'll maybe focus in on my area around research ethics or the IRB approval process, and the project we're doing at the moment, have been doing in Kenya and Ethiopia, has been really highlighting that research ethics is often seen as in a regulatory fashion. And if you take the example of like an informed consent form, you got to get it written, you got to get it approved, and then you make sure you get a signature on it. So it's a very regulatory, get through this so we can get to the project. And part of what's happening though is there's a realization that the regulatory dimension is important. It needs to be there because improvements can happen through that. But that you also need to actually get into the ethics of what you're doing. And through some of the work we've been doing, we've been engaging with community participation. And so rather than seeing that we come up with our forms and we go there and hopefully they agree to do to participate with us or be subjects for us, instead seeing these are people with great knowledge based on their daily lives, their practice, their traditions. And by working with the community, we can build projects that are better for the needs that are right there, and they actually can be implemented in better ways. And so in one case study that we did, we found that through having that dialogue all the way down through the various levels of community and local officials, that the community then was willing to help the researchers find the animals that needed to be tested. They knew which roads were, passable or not. They knew where the security problems were and how to avoid them. And so by really engaging, I think, in a truly One Health way, engaging everybody, the research benefited. And so the results will be better. And then hopefully when the kind of new strategies, new interventions or policies come about, there will be buy-in into those because communities know that they've been part of developing this and getting it addressed. So I'm hopeful that we'll change from ethics being seen as this regulatory thing, but instead a way to really engage with everybody who's part of it and benefit I guess, all factors of the humans, animals, and environment that are related to those projects.
Can I add a thing? It's on? Okay. I want to add just a thing that I just remember now, because there are so many variables, but behavior, not only I thought about politicians, but we have also a big issue. I was talking to Watson this morning, but don't you think that we have to really be prepared to engage our current students with so many mental health issues, burnout syndrome? Andrea is here. We are doing a project together on that and Professor Alexandre. But how are they now? How our future students will be after this pandemic and so on? Because engaging is my classes now are totally different 5 years ago and 10 years ago. I don't know your experience on that, but it has been so hard to engage students with so many problems, and of course financial problems after the pandemic, that it will be another big point when we combine experts panels, politicians, and us. So okay,
Start us on, what you got me thinking about what we're missing. And I teach ethics, and I often find that ethics are missing in a lot of what we do as an integrated part of our curriculum. And I'm wondering what's missing in terms of the One Health curriculum that we really need to be considering for integration as we move forward.
standardization. Because if we go to 5 different schools, let's say vet schools, they teach the subject differently. So I think one thing is, where is the definition? What are the objectives and what we expect? When we standardize that, I think it's easier, but standardization is not easy.
So on the idea of standardization, so we, I remember we interviewed here for, it was discussed as like, is this a One Health position? What is this? It ended up being advertised as an ecosystem health position. Sorry. We still have an ecosystem health program. So yeah, and the standardization. So I decided as the chair of the search committee that I was going to have all of the applicants give a lecture on what is ecosystem health. And at the end, I was going to survey the students and have them answer the question, what is ecosystem health? And from most of the candidates, it was very confusing. Because I mean, they gave this presentation and they talked about these, different One Health concepts and applications, and like nobody came out with a like, this is the definition. And the students couldn't then communicate what the definition was. So yeah, so the idea of like, what is this? And also what isn't it, right? So if you are something, like One Health could be everything. I mean, it's like everything is related. And I was just thinking about, how do you design a system to keep people flourishing? And I'm like, well, that's, like there's city and regional planning in that. And there's, all kinds of other aspects. Like, is there a border that says, well, we don't do that? And I feel like, no, there isn't. So it makes it tough for teaching students to say, like, when do you stop? Mike has to respond to the bio.
No, I'm just saying there's an example in real time where where lexicon terminology matters but that's a discussion behind the scenes. But forward facing though, and seriously, it is an example of the challenge that lies ahead. I mean, how do you make the, just the general public, but more importantly, the professions that have to be part of this integrated team, and then the agencies that we're going to have to rely on to help fund it. How are we going to enhance awareness if our messaging is not in alignment? So that's the need of, that's another part of standardization, is aligning the pitch, if you will. And so when we define One Health, we need to embrace the same definition, or at least something that's really similar. And we talk about it, and I recall, I don't know how long ago, everything's a blur when you're at this point of my life, but it was maybe within the last 10 years, Dr. Gabrias and I were in Dovis, Switzerland, right, for a global One Health conference. And there was one of the sessions on what is One Health, or how do we want to frame it? And one person said, well, it's a movement, another this and this. Well, I think we've adopted it as an approach. And I think if you embrace it as an approach, we don't have to worry about being all things to all people and worrying about this global infrastructure of some One Health czar. But it's simply another deliberate approach that happens to be multidisciplinary, happens to be integrated. And, it's just another topic area. I was in a college of medicine. I was a department chair for 19 years, a professor. And as a result, on the leadership team, where we commingled scientists and clinicians on the leadership team. And I remember in the late 90s, the rollout of, complementary medicine, right? Complementary medicine was the team approach, right? It wasn't just physicians. It wasn't even led by physicians. It's led by the focus area. Well, all of these have similarities, and what's going to make it become a reality or not is accept it as an approach, not something that has to be the only way, but simply another way. We happen to think it's a better way because of efficiencies and hopefully enhanced outcomes that come out of the integrated effort.
Well, I would say that what I think needs to be added is the humanities and the arts. And we've had two issues come up already: the well-being of nurses and frontline workers, and the well-being of our students. So I think we've got to get into that emotional side of things, because with an ethical thing, you might know that the right thing to do is to feed the poor, but you still go off and take care of yourself and you don't give anything to help them. So what takes you from knowing the right thing or knowing the right science to actually doing it for the right reasons? That involves your heart, it involves your emotional commitment. And George Bernard Shaw is an Irish playwright who said, you use a mirror to see your face, you use art to see your soul. And I think in my own teaching of ethics, I'm increasingly bringing literature, photographs in to capture that emotional side that students are having as they look at things or listen to stories. And hopefully that will go on then to actually lead to changed hearts and to treating humans, animals, and the environment with greater respect, with the dignity that they deserve, and hopefully making the world a better place to live in and to flourish in.
I just wanted to say, I think I completely agree. And I think you articulated that very well. And I think that humanity is, we talk about burnout and wellness, humanity, relationships, whether with each other and with, animals, our environment. That's what, that's the antidote to burnout. And we really have to take care of each other.
Another antidote to burnout is partnerships and the relationship building. And I don't think anyone's done that better than Wanda Singabreas, who's brought us all here today and has taken us around the world to do things that I know I personally never imagined I'd ever be doing. And I'm curious, and this is my last question, and please, we want you to contribute with our very last QR code. So please, we'd love to hear your thoughts on this. And I'm going to ask you to come down the line this way and give me your response of what you think is the most important role of a group like GoHi. What exactly, how does it contribute to One Health overall, to yourself as a participant in this, and really just as a person who cares about other people and animals and plants and biospheres and all of the other terms that we've thrown out. Dr. Omathu?
Well, I think you kind of introduced the question with the answer in terms of partnerships. It's a place where people have got similar ideas, where they can come together and, you know, iron sharpens iron, but also provide the teams that can then actually kind of go out beyond the people that have sort of got the ideas and take it, find ways to collaborate together so that you can move out and make the impact be bigger.
Completely agree. Breaking down the silos, you know, I think throughout training, throughout higher education, we tend to get very siloed in the departments that you're in and everything you do. And so being able to break down the silos and learn from each other and benefit from those partnerships.
Yeah, and I agree that ideally breaking down the silos with the approach, but I think it's become too unrealistic, too idealistic. So the next best thing is to connect the silos, right? There's nothing wrong with having individualism, if you will, within a profession and among those professionals. So that you sustain the silos. The problem is connecting them. And if they're connected and truly commingled, and you're moving from silo to silo, that's the next best thing. I mean, if it were me, if I were running the university, I've said this publicly several times, probably why I'm still a vice dean, but I probably, you know, I mean, ideally you don't need colleges, right? You build thematic areas around the whole, but that's unrealistic. I mean, silos of human nature, animal nature, right? Otherwise we'd all live in communes. But so connecting the silos is an approach. To answer your question relative to Global One Health Initiative, that small I is a placeholder for institute. We are an institute. We function as an institute. We do things as an institute does. And we have a great place to build One Health because of the complexity and diversity of this university, 7 health science colleges and 8 other colleges that all have either a direct or indirect link to the One Health approach, including College of Food, Ag, and Environmental Science, among others. So taking advantage of that, and I'll bring it back one more time, the best thing that we can do that we hope to continue to do even better is, again, what can we do to enhance the bidirectional approach? So we're at those committees that are influential with the resources, and they're not just committees, it's our interactions with agencies, right? CDC, WHO, other groups, but also what do we have control over at the grassroots level, and making sure we're more deliberate to move it forward from both directions. And perhaps part of being the deliberate is to prioritize, do we want to try to implement that broader model now, or should we take it stepwise and focus on just a component of the model and let it evolve from there?
Okay. For me, it's collaboration, so that's why I'm here. So one thing is our mentor on teaching us how to collaborate, and without that, nothing. And another thing is I would bring back again, engage our students, because if we have data, if you have everything to share, started with students, going to field, coming back to the lab, running and doing things that we don't have time to do it because we are arms and
Yeah, so I think one of the really great functions of Go High is being sort of the face of One Health and the communications of One Health. So if I do a One Health project and you do a One Health project and you do a One Health project, maybe like our individual departments might talk about it, we might talk about it, but that idea of it all goes towards Go High and people can see, look at all of this stuff that's being done and how it all is contributing to the concept of One Health. I think that of having that mascot, or that, you know, that doesn't sound right as mascot, but the face of One Health that people can see the reputation of and know about. So, I mean, when I go other places, people have heard of Go High. So I think it is very, very helpful in getting future work in this area.
Do we have responses?
I was getting a chuckle out of one of them that said the most important role that groups like Go High would be to clone Dr. Cabreas. But there is a resounding theme here about the next generation and the focus of groups like Go High being, as an academic at a university, weaving One Health throughout the curricula, relevant academic units that will lead to capable graduates that can address future challenges. A lot about capacity building, awareness transfer, knowledge transfer, awareness creation, and having that percolate through the community so that citizens can contribute in a meaningful way as well.
Terrific. Well, this 2 hours has flown by. Can we have a round of applause for our extraordinary panel? And can we have a round of applause for our mentor, so poignantly put, Dr. Cabreas, who brought us all together here and so many other times and places. I'm guessing that many of you can't imagine that it's been 10 years since this initiative took root and started to grow, and to see where it has gone, even from my perspective, is truly extraordinary. I am gifted to have been part of it in any small and transitory way. And I'm so grateful for the way that has shaped my life and the way that it continues to shape all of us locally and globally. So I thank you for being here today. I thank you for being part of this extraordinary initiative, and I wish you all much health.
Before we close, I just again wanted to thank the panelists, thank our wonderful moderator, all of those who helped bring this event to life today. I've been doing some on-the-fly thematic analysis of what you all have been talking about, so I could summarize some of the key themes that have been brought out with today's discussion. So a couple of things that I was focusing on and thinking about while you all were talking. Many of you discussed an origin story that involved local communities and working with those communities that really brought out the connections between people and planet, and how those groups can often have the connections resonating more loudly and more clearly. So the importance of that in our research, focusing on our learning and our outreach, bringing that back to local communities. You mentioned radical listening, which I really thought that was a poignant term, and really the importance of partnership and reevaluating how we have this flow of knowledge does go bidirectionally, and we're learning from our partners and staying open. And regardless of the number of letters after our name, we are all students. So doing One Health work requires humility and openness. Regarding challenges, a lot of the challenges we talked about were foundational, bringing busy people together to accelerate awareness of diverse professionals who need to be involved. And that requires integration of people, places, and things. Logistics continues to be a challenge, but in today's connected society with, the silver lining of COVID bringing us more connected around the world, we can maybe strategize how we can continue to stay connected to bring these people and ideas together. We talked about the difficulty of standardization of protocols, but how we could potentially work for quality assurance and quality control and data sharing across different sectors, how we can continue to do those types of things well to get through some of these tough challenges of working on One Health work. Regarding the solutions, we talked about that people are often pointed the finger at as being the problem, but they are also the solution. And the solutions involve things like policy, education, we heard a lot about, and behavior. And for that, we need to involve humanities and the arts, which are outside the health sciences. And so really focusing on the flourishing of mankind, the flourishing of humans, which cannot happen without the flourishing of our natural ecosystems, our built environments, our animals, and our plants. So with that, we hopefully will have focus on One Health being the future path forward, to be deliberate, be integrated. I heard those terms loud and clear. And hopefully that'll be the future that we can all work towards. So thank you all again. Happy One Health Day.